I'm talking about my PhD research program, which is investigating ayahuasca ceremonies as a candidate therapy for bipolar disorder, which is a bit of a controversial topic, both within psychiatry and within the ayahuasca community. I'm going to be presenting some background information, my own personal theories, and some initial results from my PhD research. So, sure. Great. So, what, does this click? Yeah, okay, cool. Okay, so introducing bipolar disorder. It's a serious mental illness which manifests with extreme mood swings and in significant changes in brain chemistry and affects approximately 1.6% of the population. On one pole of the illness, there is depression, which is melancholia, morbidity, flatness of mood, lack of energy, and an impairment of cognition and creativity, an attitude of pessimism and futility, and an inability to experience pleasure. Mania, on the other hand, is involving a speeding up of cognition and creativity, together with massive increases in energy and a decreased need for sleep. Mania can be euphoric, with excessive happiness, libido and overdrive, reckless optimism, and grandiose spending, whereas dysphoric mania is a speedy paranoia. The DSM-5 in psychiatric terminology distinguishes between 5 subcategories, subtypes of bipolar disorder, depending on the pattern of mood swings. Characteristics of people with bipolar disorder, they're severely impacted, often driven to suicide, yet are often creatively gifted and spiritually attuned. People with bipolar disorder are hypersensitive in all ways. They experience emotions intensely and have an exaggerated trauma response to painful situations. These are easily thrown off balances by substances which stimulate or suppress the central nervous system, but ironically they often use alcohol and drugs in excess to cope with their feelings. With such sensitive emotions, perception and neurobiology, they are easily traumatized, and many are therefore in a state of post-traumatic stress as well. So statistical analysis of people with bipolar disorder reveals the following characteristics are unusually common amongst them: profound creativity, genius cognitive ability, passionate sexuality, and hypersensitive spirituality. Many perceive subtleties of sound and energies and report paranormal spiritual awareness. In the time of the ancient Greeks and in some indigenous societies, many bipolar people were revealed for their spiritual awareness and often playing the role of shamans in their tribe. Dr. Kay Redfield Jamison, herself a psychiatrist with manic depression, has thoroughly documented the correlation between creativity, the artistic temperament, and bipolar disorder, showing massive increases in statistical correlation. Hypermania, dysphoric mania, and euphoric mania all involve an increase in cognition and analytical intelligence. Therefore, many of the most sophisticated creative works were done in a manic state. Composer Robert Schumann's creative output correlates with his mood swings, and as is common for musicians, writers, and artists with bipolar disorder. You can see where he's getting a lot done and where he's getting very little done, depending on his moods. So some notable creative people with bipolar disorder are writers like Virginia Woolf, Joseph Conrad, Herman Hesse, and Sylvia Plath. Artists like Vincent van Gogh, Mark Rothko, Paul Gauguin, and Edvard Munch. Actors like Stephen Fry, Richard Dreyfuss, Heath Ledger, and Robin Williams. And musicians like Jimi Hendrix, Kurt Cobain, Amy Winehouse, and Charlie Parker. The statistics are that 30 to 50% of people with bipolar disorder attempt suicide at least once, and 11 to 19 eventually do kill themselves. Edvard Munch was stuck in a mental asylum but never attempted suicide. However, every other creative person in these slides that I'm mentioning here has either attempted suicide, died of excessive drug use, or killed themselves. And whether or not they attempt suicide, most bipolar people spend a significant proportion of their life in deep depression. Bipolar disorder certainly has biologically determined causes, some of which are genetic, and therefore a biological intervention is required to manage their condition. alongside the benefits of lifestyle and psychological interventions. While normal peoples have normal mood swings resulting from life experience and psychoactive substances, their brains have a built-in mechanism which balances their mood back to a normal state. But bipolar people seem to be missing the genes for this balancing mechanism. Therefore, stimulating experiences or substances push their moods upwards and upwards, whereas sad events or sedating substances lead to a downward spiral. The pharmaceutical, sorry, but the font didn't transfer properly, so it's a bit out of whack. But, the pharmaceutical drugs usually prescribed for the bipolar disorder may stabilize mood. They may do that, but notoriously numb creative and spiritual consciousness, dampen the passion of sexuality and the sensitivity of emotion, as well as dumbing intelligence. This may not be problematic for some bipolar people, and I admit there are many bipolar people who are satisfied with the currently available drugs. But creative and spiritual people often reject these drugs, preferring to keep their creative spirit and sensitivity even at the expense of extreme mood swings. Furthermore, a common mechanism of action shared by all these drugs is to render the patient less conscious of their trauma rather than facilitating a meaningful healing experience, inducing an inflated ego and a plastic smile. These drugs repress trauma rather than express trauma, and so trauma is carried subconsciously and never resolved, which is the opposite of psychedelic-assisted psychotherapy. So these drugs produce stoicism, which allows for functionality in the mainstream workplace, but has the opposite consciousness required for artistic productivity. When taken alone, most pharmaceutical and herbal antidepressants also induce mania in bipolar people because they're stimulant, right? So, and most antipsychotics, which are prescribed to lower mood, they on their own induce depression. But ironically, these are often prescribed by the psychiatric pharmaceutical system for bipolar people at the same time to balance their mood swings. And so their side effects are then combined. So now, the only naturally occurring substance which psychiatry acknowledges as beneficial for bipolar disorder is the trace mineral lithium, which is often in mineral water. But lithium is usually prescribed at such a high dose that it causes weight gain, thyroid dysfunction, emotional numbness, and suppresses the libido and creativity. Unfortunately, bipolar people who stop taking medication often become manic or suicidal, and they heavily self-medicate with alcohol or illicit drugs and die from an overdose, as did Amy Winehouse. Therefore, an appropriate medicine for bipolar people continues to elude psychiatry, and there's plenty of medications out there, but an appropriate one eludes psychiatry, and it eludes the psychedelic renaissance too. So bipolar people continue to suffer extreme mood swings, which in turn has a huge impact on their whole communities and on the mental health budget. So ayahuasca is becoming a popular alternative medicine for the treatment of depression, anxiety, and post-traumatic stress. So while scientific research with double-blind controls has not yet proven that ayahuasca ceremonies are a good treatment for depression, the anecdotes very clearly say yes, and the clinical trials are underway in Brazil. So an obvious question is whether ayahuasca ceremonies can benefit people with bipolar disorder. So ayahuasca is a plant medicine traditionally used by shamans and of indigenous tribes from the Amazon for individual spiritual healing sessions, and is also considered a sacrament by these tribes, and has been drunk in group ritual context for the purpose of communion with the divine. The atmosphere and culture of most ayahuasca ceremonies, with open-hearted people in a sacred temple with beautiful music, would be a better healing environment than most psychiatric wards. The ritual of processing emotions with heightened awareness followed by cathartically releasing them is more in tune with the artistic temperament than reductionist clinical psychiatric methods. Common anecdotes say that ayahuasca enhances creativity too. Therefore, on first assessment, ayahuasca ceremonies appear to be an appropriate therapy for bipolar disorder. The psychological mechanism of ayahuasca is like that of the other psychedelics. They enhance consciousness to face trauma and painful emotions directly. trauma is then able to be expressed and let go of in cathartic ways. The love in the room, together with the harmonic resonance of the music, overwrites the trauma and inspires conscious evolution. That's the psychological mechanism. Now, in terms of psychiatry and neurobiology, the biological intervention, the ayahuasca is believed to act like other serotonergic substances which have antidepressant and anxiolytic effects, like the SSRIs, like Prozac. This is the belief that ayahuasca would work on depression like Prozac does, for example. Ayahuasca is a tea that's because it's brewed from the vine of Banisteriopsis carpi and the leaves of Psychotria viridis in boiling water. The main psychoactive ingredients are the monoamine oxidase inhibiting beta-carbolines, which are harmine, harmaline, plus, this is not very well realized, the weak serotonin reuptake inhibitor, tetrahydroharmine. Those things are from the vine. Whereas together with what is also an endogenous 5-HT2A receptor agonist, N,N-dimethyltryptamine, DMT, right? From the leaves. The antidepressant action is not surprising, given that the harmonic alkaloids have MAOIs and SRI action nearly identical to the pharmaceutical antidepressants. And Dennis McKenna also discovered that these alkaloids promote the growth of new serotonin receptor sites. Okay, but psychiatry warns against psychostimulants being taken by bipolar people because there's so many documented cases of mania and psychosis being induced by pharmaceutical and herbal antidepressants, and also by stimulants such as amphetamines, THC, MDMA, mescaline, psilocybin, and LSD. So I certainly agree that that these are all dangerous for people with bipolar disorder, and it's especially wise that bipolar people are not allowed to participate in MDMA-assisted psychotherapy. The assumption is that ayahuasca would have a similar overstimulating effect and induce mania in bipolar people. Moreover, the commonly held view in the ayahuasca community is that bipolar people should not be allowed to participate in ayahuasca ceremonies. That's the standard. If you look on the forms for can you come to this retreat center in Peru, they'll usually say ayahuasca, tick, no you can't, okay? Now, these are legitimate concerns, but at this stage in my research, my personal opinion is that these experts are giving bad advice about people with bipolar disorder, and that they're really turning away a seriously ill and suicidal population without asking bipolar people what really happens when they drink ayahuasca. I now wish to present a theory which at this stage of 1 out of 4 years in my PhD is just a personal opinion. Over the next 3 years, my PhD research program will be a scientifically rigorous mixed method investigation, but at this stage, Breaking Convention presents a valuable opportunity to share ideas, seek expert guidance, as well as interviewees for my future research. So in combination with my own experimentation, qualitative interviews, and also interpretation of the laboratory work of Professor David E. Nichols, I hypothesize that a particular brew of ayahuasca, taken in a compassionate therapeutic setting with strict dietary and contraindication restrictions, is a safe and effective antidepressant which does not trigger mania. The foundations of my beliefs is a detailed analysis of the experience of one ayahuasca ceremony passenger with bipolar disorder, namely myself. This is a self-portrait in a state of bipolar disorder type 2, depression mixed with dysphoric mania. Now, I've had the full spectrum of manic depressive experience, both euphoric and dysphoric mania, psychosis, severe depression, drug addiction, suicidal tendencies, and on and on. The first antidepressant I was prescribed was GlaxoSmithKline's Seroxat, billion pound profit-making product. And this induced a psychotic mania which led to being sectioned in a psychiatric hospital. And then how I had a complicated and treatment-resistant condition. And over a decade spent seeking help from psychiatrists, I was prescribed a series of 17 different psychiatric pharmaceuticals. None of these genuinely healed my emotional problems. I was never genuinely happy, and the side effects were horrible. I left the system. I proceeded to seek a plant medicine that could help my condition, and I tried a further dozen herbal antidepressants such as St. John's wort. Each of these was either too stimulating or too sedating, and my manic depressive mood swings continued until a friend suggested trying a special brew from the Amazon. Ouch. 8 years ago, I drank ayahuasca for the first time in Glastonbury. The first experience... The first experience was problematic because the facilitator was unskilled and consequently I was neither well prepared nor cared for. The following year, I discovered the Santo Daime community in London, which is the Brazilian religion using ayahuasca as a sacrament. And their professionalism, duty of care, quality of sacrament, and compassionate community was so healing and inspiring that I initiated myself into the religion. I have continued my healing journey with the Santo Daime community, as well as with ayahuasca facilitators from all sorts of different traditions. And in Australia, there's this sort of it's kind of this evolution of ayahuasca in a multicultural setting. So now, for a week or two after a good ceremony, I feel a sustained sense of humble happiness and emotional balance. My productivity and creativity, 5 minutes, that doesn't even be interesting. My productivity and creativity get massively enhanced too, but I do not accelerate into mania, and therefore I become better able to make sensible decisions, keep track of time, and find emotional balance. And when I make conscious decision to calm down, I can feel my brain doing so. I do not feel addicted to ayahuasca, but after about 2 weeks, I gradually slip into depression and I'm likely to become traumatized. After about a month without ayahuasca, I usually become suicidal. Now, I'd been on a trajectory of very clear mental health increase, followed by decline without it, and more recently, a massive healing since I regained access. Having functioned for 8 years without pharmaceutical drugs, now my sacred ceremonial use of ayahuasca is my only psychiatric medication. Indeed, I'm not taking any psychoactive substances whatsoever apart from ayahuasca. And in my experience, ayahuasca works on an ongoing biological intervention for depression, as well as healing underlying trauma. Nor have I had any manic episodes, and actually ayahuasca calms you down when I'm overstimulated. In over 100 ceremonies drinking ayahuasca, I've never gone manic nor psychotic. And I still have strong mood swings, but these are within the normal boundaries of the artistic temperament. In this N=1 study, I conclude that ayahuasca is safe and is actually the best of 30 psychoactive medicines I've sampled for the stabilization of my brain chemistry. And crucially, ayahuasca enhances my artistic creativity, emotional sensitivity, sexuality, and spirituality. And this is the foundation of my hypothesis that it's a candidate therapy for bipolar disorder, which I intend to investigate with more scientific methods. So, my second batch of evidence is based on the initial testimonials of 23 other people with a diagnosis of bipolar disorder who've attended ayahuasca ceremonies. Following my presentation at the World Ayahuasca Conference in Ibiza and 2 conferences in Australia, I've been told their stories by themselves and by friends. These are quotes from bipolar people from their experiences. Now, I've analysed the positive and negative experiences of a sample group of 24 people, and here I'm defining positive experience as having psychotherapeutic benefit in terms of trauma, antidepressant benefit, and in brain chemistry without triggering mania. A negative experience here is defined as bipolar passenger having a traumatizing experience or going manic or going depressed. In these terms, the reports are mostly positive, and these are some pretty staggering quotes here. Now, however, there are some negatives, and the analysis of the circumstances of the negative experience reveals actually more optimistic results, because in almost all cases when bipolar passenger had a negative experience with ayahuasca, they were simultaneously consuming a contraindicated substance. The scientific explanation is the MAOIs amplify the other stimulants and therefore destabilize, right? So all these substances are contraindicated and therefore they are actually false negatives and should not be taken as evidence against ayahuasca for bipolar. Now, again, many ceremonies in Australia are not using real ayahuasca. Instead they're using Syrian Rune, which contains the MAOIs but not the SRI, and I believe that this changes the weighting of stimulation with more action on the noradrenergic system, which would explain why they're going manic. Now, the only remaining negative experience is one of my own, which, when analysed, all involved different brews of ayahuasca tea that had a higher ratio of vine to leaf. So ayahuasca can be made with different ratios of carpi and viridis leaf, carpi vine and viridis leaf, usually between 2:1 and 4:1 ratios. In Australia, these leaves are scarce, and so they often skimp on the leaves, and the brews have too much vine and so on. Now I'm going to skip a bit. Right, okay, so in my experience, my opinion, 2 or 2.5 parts of vine per 1 part leaf is the best mixture for creating a mood stabilizing medicine. I'm going to conclude with some statistical analysis. So we've got 62.5% all positive out of the 24 people, some negative, some mixed. As I say, a lot of those are false negatives. If you look at the whole 1,800, now some of the people, actually, 3 of these 24 are themselves facilitators of ceremonies who actually say that it helps their bipolar, helps their facilitation. And so they've done hundreds. Now, if you add up everything, we're talking about over 98% safe for bipolar people and over 99% safe when they're following the contraindications in my study so far. Now, I'm going to do some research into the phosphoninositide cycle later on. I don't have the results yet. That's the cycle that is actually speeding up and slowing down when people's moods are going up and down. It seems, according to the research. Okay, I'm going to refer to the work of Professor Nichols, who discovered that 5-HT2 receptors is a common target of serotonin, DMT, LSD, psilocybin, and so on. But that they each have different cascading effects on this receptor, and crucially, the DMT has a short duration of action on this receptor, and that provides a scientific explanation possibly for why it doesn't DMT does not overstimulate and trigger mania. I've got a lot more to say about that, but I can't. So for now, what remains unresearched is what DMT does. Now, the experiments with Syrian Rune actually indicate that DMT is a stabilizing effect as well. And to substantiate this theory, I draw on another of my own, Ceremony 14, passenger 14. He's bipolar type 2. He was taking Pristique and a Seroquel, and ayahuasca was good for him, but he couldn't find ayahuasca, so he started smoking DMT as a 97% pure crystal. Now, in a weekly shamanic ritual, he made up based on his ayahuasca experience. These crystals from acacia were 97% DMT, so whatever effect came from the DMT, not from an MAOI or SSRI, right? So after each dose of DMT, his anxiety and depression were significantly relieved for 4 days. He was able to reduce his pharmaceuticals. He continued his trial until he came off pharmaceuticals completely, remained in remission for 4 months. And while MAOIs and SRIs are known to affect mood, this case clearly demonstrates that DMT does too, and has a balancing effect on the mood swings of bipolar people. So the fact that my own experience of different effects from the different brews corroborates this theory, because the brews with excessive vine, i.e. excessive MAO and SRI, trigger mania, whereas the brews with higher DMT content have a mood stabilizing effect. Now, this week, Amy Winehouse's biopic is released, and she died of drug overdose trying to self-medicate her bipolar disorder. And my question is that, well, my belief is that Amy's life and creativity could have been saved and healed if the ayahuasca ceremonies that were happening in a blossoming subculture who was hiding from the authorities at the time that she did not go to rehab, right? If they'd have been an available choice in the mental health system, I think she'd still be singing. And I hope that my PhD will benefit the next generation of bipolar people. So if you know any bipolar people who have experienced ayahuasca ceremonies or who have considered doing so, please ask them to contact me. Thank you very much. Muito obrigado.
So we really haven't got time for questions.
That's right. Thanks.
Afterwards. We can catch you later.
Yeah, great. Totally.
We need to ask questions. I'm just checking. Is Rita here? Rita here? No? We'll have a couple of questions.
Couple of questions? Great. Mike, questions, yeah.
I have a question.
Yes.
So, Mudge, firstly, I'm really proud that I'm supervising your PhD. It's either going to be a complete disaster, or you're going to revolutionise psychiatry. So I'm really looking forward to it, and I think you're the best man for the job. So that's the first thing. Secondly, I'm really pleased that you've got this extra data of other people's anecdotal experience with bipolar, because I think the N=1 model is potentially damaging, and the worst thing about the N=1 model is, what if your apparent diagnosis of bipolar was a misdiagnosis? And what if the reason you have been drug-free and relatively symptom-free for 9 years is because you simply don't have bipolar? Now, the reason that's an important question for you to reflect on is because the critics of your PhD will ask that question.
That's a very good point.
And so especially the doubting psychiatrists who put their faith in the pharmaceutical industry, they would say, well, this guy just doesn't have bipolar. Lucky guy.
Well,
and,
do I have bipolar anymore is a question. And, well, I have managed bipolar. I have well-medicated bipolar disorder. Now, which ain't a problem anymore. And I'm going to actually refer to my history, and you should see, I've got recordings of my music, I've got artwork, I've got stories of going